With the spring season comes lots of pollen and with it, allergies. It's a serious issue. 37 million people suffer from some type of sinus infection caused by allergies, but many people don't know how to be diagnosed or what their options are for treating it. So joining us this morning to break it all down is Dr. James Ludwick with West Houston ENT and Sleep Center. Dr. Ludwick, thanks for joining us this morning. It's clear to see that the pollen is out there. All our cars are covered in yellow. But is that the problem that we're experiencing with our heads and noses?
Yeah, well, certainly the pollen on the cars tells you that things are in bloom, but it's the big pollen doesn't really get in your nose. It's the smaller particles that end up in there. But nonetheless, yeah, things are blooming and people are breathing those in and getting lots of symptoms.
Most people probably think, well, it's Houston, it's springtime, go to the drugstore, get some, something for your allergies over the counter, but that may not necessarily be the right way to treat it or a permanent solution, right?
Yeah, well, I mean, obviously people have like seasonal allergy or just symptoms for a short period of time. Certainly over-the-counter drugs are very effective, but mostly people are putting pills in their mouths, and the problem is really in their nose. So one trick is to really treat the nose instead of treating the body. You can either wash your nose with saltwater irrigations, and there are a lot of topical products that you can use, like topical steroids or topical antihistamines, kind of like a liquid Zyrtec, if you will. It gives you better relief because you're putting the medicine, where the problem is, instead of, in your bloodstream where you don't really have the problem.
The first step, I would imagine, is going to see a professional and figuring out what you're allergic to and then treating those specific things. Is that right?
Yeah, well, again, if you're just having a symptom here and there, sure, over-the-counter is fine, treating yourself. But if you're having chronic congestion, you're relying heavily on decongestants like Sudafed or topical things like Afrin or like four-way spray, or you're having lots of recurring sinus infections or facial pressure, those are things that we're really good at actually making a lot better with procedures instead of relying so much on medication.
Permanent solutions.
Right, permanently, yeah. We can.
What are you talking about? What's involved in that?
Well, so for example, chronic congestion, a lot of times that's due to big turbinates. Those are the things in our nose that humidify the air. Your nose humidifies air, and what allows our nose to do that is something called a turbinate. So we have a nice way, really quick and painless, to make the turbinate smaller, which when you use a topical decongestant, you're just making the turbinate smaller chemically, and what we do is we make it smaller mechanically. So it's doing the exact same thing, just one's permanent and one's temporary.
All right, well, thank you very much. Appreciate it. Where can people go to find out some more information?
I've actually a pretty informative website, www.westhoustonement.com.
All right, and the turbinate, is that the only permanent solution, or are there other things?
Well, then we treat the sinus. That's for the nose. Or of course, sinus, sometimes simple sinus procedures can really help with pressure and things like that.
All right, very good. Well, Dr. Ludwick, thank you so much for joining us. We do appreciate it. If you want to find any more information about this to help fix your allergies once and for all, go to our website, abc13.com. Still